All right, I have a brainstorming activity for you to complete. This is just for you to complete on your own. You will not be submitting this to me anywhere. I have a question for you, and that question is, are you healthy? Very simple question. Are you healthy? What does this question make you think? How would you respond to this question? I'm going to give you, please go ahead and pause this video and jot down a response to this question. Maybe you have questions about this question. Go ahead and record all of your thoughts. Okay, so at this point, hopefully you have responded to that question, your notes. Are you healthy? Why or why not? Again, this is for your eyes only. I'm not collecting this. So you might have questions. What do you mean by healthy? What kind of healthy? Physical health, mental health, right? These are all interesting, important questions to ask. And the fact that we even make a distinction between one's physical health or mental health is telling about our culture and the way that we classify health. Maybe some folks thought, well, I'm not taking medication right now, so I'm pretty healthy, right? That would reflect a biomedical idea of health being linked to the absence of medication. Maybe some of you think, oh, I am extremely healthy, like I work out and I take vitamins and supplements and I have a whole, have a smoothie every day, right? That's connected to this idea of health is something that can be purchased in a marketplace. An idea of health is something that is that requires substantial time, that requires substantial disposable income. Right. What you can see that I'm getting at here is that even the idea of health or being healthy, what does it mean to be healthy, is culturally constructed, right? That societies will have their own idea of and cultures with their own idea of what constitutes healthy or not healthy. To give an example, a more concrete example of that, let's talk about losing baby weight in the West. You might have heard of this idea of like how to lose baby weight after pregnancy, right? To get back to your normal self, quote unquote. Right? Of course, this shouldn't be surprising in the West, in a patriarchal society. There are ideas that women should maintain beauty. Women are should be beautiful for the male gaze, for the female gaze, for whatever, for a broader public. But it's worth noting, I think, that in Madagascar, where I work, for example, if someone was to lose a considerable amount of weight after giving birth, that would be seen as a problem. That would be seen as a sign of a lack of health. In fact, the word like to gain weight in Malagasy, mazoaina, literally means to gain life, right? So the point here is that, again, we tend to, women have are expected to lose weight after birth because losing weight or being smaller is traditionally a sign of beauty, et cetera, et cetera. But if we're to look at that from another culture's perspective, that's a sign of being extremely unhealthy. Right? Okay, so we've talked about health, how it's culturally constructed. Right? Our ideas about health are sometimes reflect our own culture's ideas about what it means to be beautiful and gendered beauty norms, for example. Now let's look at the absence of health. So first, I told you we would talk about disease and illness. So let's start first with illness. Illness is a condition of poor health perceived or felt by an individual. So this is a subjective experience of the person who is going through this experience. Let's take, for example, this image of a cancer patient, right? Illness is this person's experience with that condition. So the individual will assess or appraise their bodily and mental processes, right? How am I feeling right now? They kind of run through their symptoms and try to determine whether this is normal, whether this is abnormal, whether this is healthy or unhealthy. Some of you may have spent many a night WebMD trying to determine whether a symptom is a sign of something more sinister. This is something that we have seen, for example, in Prince Charming, as I've talked about before, in spirit possession, right? Some sort of symptom or sign of bodily um, um, lack of ease or disease, if you will, could be a sign of lack of poor health. And we did not watch Mohammed, so you can ignore that second example. So disease, on the other hand, is a scientifically identified health threat caused by bacteria, virus, fungus, etc. So we often say in medical anthropology that a disease is created in the clinic, right? A patient walks into the hospital or clinic with an illness, but they leave the hospital or clinic with a disease, right? Because a disease is what the doctor determines the individual has based on the use of the Western scientific method, based on some sort of analysis of the person's body. This could be through an X-ray, right? So we're taking this kind of visual sign of the body, and it's a sign of some other greater disease, right? So again, for disease, it's all about the goal from Western biomedicine to come to some sort of diagnosis. What is the root cause or etiology of a disease, right? So we can see this. This could be a brain tumor, for example. We have a sign through an image. That is what's going on here. Okay, so in a few sentences, again, what is the difference between illness and disease? You can skip through these because we didn't watch this film. One way that I often teach students the difference between illness and disease is that I'm looking at an apple. Would you say that this is a diseased apple or an ill apple? Only one of these is grammatically correct. It's a diseased apple, right? But again, a disease could be caused by fungus, bacteria, etc., and that makes sense, attacking this apple. But this apple does not have a subjective first-person, first-hand experience, right? And that's what illness is all about. So again, this apple cannot have an illness because an illness is a personal human experience, right? That's narrated, right? Illness is all about the way that we narrate the lack of the lack of our health. So biomedical frameworks generally leave little room for the patient's suffering, right? Think about, if you know anything about how doctors typically are forced to work, it's to kind of pump patients out as quickly as possible to make money for the clinic, for whatever hospital or practice they're working for. Rather, the emphasis is, of course, capitalism, but also gathering data to come to some diagnosis. This is very different from, say, in the practice of spirit possession, when an individual might go to a spirit medium because they have certain bodily symptoms. And there, it's all about the individual talking to the Trumba spirit. In the case of Madagascar, they'll talk about all sorts of things. They'll talk about family issues, bodily, health issues. And so, as cultural anthropologists have written elsewhere, something is lost when illness is replaced with disease. When spending time listening to the patient's narrative is diminished, and instead when the goal becomes trying to come to a clear, crisp diagnosis. This brings us to the last portion of the lecture, medicalization. This is the process through which human conditions or distress are defined and treated as medical issues. In other words, this is when we come up with a term for a medical condition. And so I'm going to go through the examples of PMS and dissociative identity disorder in the third portion of this lecture, to be continued. Thanks, everyone.